Hello, I'm Dr. Bill Waggoner. Welcome to another Tuesday Tip. Last time, we began a conversation about dealing with parents who've pushed back against recommended treatment or diagnostic procedures. Last week, I said that one of the most important things was to know what you're willing to bend on and what things you're not willing to compromise on. When this is clear in your mind, you tend to speak with a lot more confidence. If a parent detects that you're not necessarily confident in your decision making, they may see it as an opening and try to convince you to do things their way. Today, I want to talk about some specific communication skills for handling the questions that come from parents who want to push back against treatment recommendations. Obviously, how you respond to their questions and concerns will set the tone for any future appointments and encounters with that parent. When a parent comes in and says, "I really don't want this," or "I really don't want that," many times they're already on the defensive, expecting a verbal fight with the dentist. Therefore, the first words out of your mouth should be, "Thank you for asking those questions," or "Thank you for letting me know your concerns. These are very important to me." When you thank someone for their questions or even for their complaints, it begins to diffuse them. They may have been prepping for a fight and now you've just thanked them. So after thanking them for the questions or concerns, the next key phrase that should come from you is, "Can you please help me understand about your reservations on the use of the fluoride or the x-rays or the nitrous oxide or whatever it might be? Can you help me understand?" This connotes a caring attitude on your part, and it also keeps you from jumping to conclusions. We may have prejudged that this parent was going to make similar arguments to what we've heard before, but then we find out that they're very concerned about the cost, or that they think nitrous is going to put their child to sleep, or any number of things. Once they've told you their concerns, repeat those concerns back to them. This helps them know that you are listening, and there's always an opportunity for correction if you have heard incorrectly. "Oh, so you don't want me to use nitrous on your child because you don't want him put to sleep. You've heard that's dangerous. Did I understand that correctly?" Now you know how to tailor your response to the resistance and how to explain how nitrous works and how general anesthesia works. Understanding and addressing the real concern rather than what we imagined is much more effective in keeping conversations non-confrontational. Finally, and I mentioned this last week, don't hesitate to suggest a second opinion. If the parents want you to treat their cooperative 6-year-old without x-rays, and this goes against your personal comfort level and the AAP guidelines, then simply say, "I respect that you're the parent and you want what you think is best for your child. However, I also have to do what I think is in the best interest of my patients, and treating them with limited diagnostic information is not something that I'm willing to do. I wish I were able to help you, but I don't believe I can. I think it would be best for you to see if you can find a dentist who's more in line with your expectations." There's a final illustration I'd like to share with you. It was told to me over 25 years ago by a long since retired pediatric dentist about these kinds of scenarios. He said, "Bill, it's kind of like someone going into a Chinese restaurant and ordering tacos. There's nothing wrong with tacos, it's just that the Chinese restaurant is not the place to expect to get them." I've used this actual illustration in some situations with parents. Then following up by saying, "I'm not saying that what you're asking for is wrong. I'm just saying that it's not on our menu. It's not something that we offer." So now I want to summarize what I've said over the past 2 weeks when handling pushback from parents. 1, come to a personal agreement with yourself about what is negotiable and what is non-negotiable. 2, often refer to your desire to provide the highest quality of care for the child. 3, thank them for voicing their questions or concerns. 4, ask them to help you understand their concerns. 5. Repeat their concerns back to them and ask if you've got it correctly. 6. See if with better understanding you can educate the parents. 7. Don't become argumentative or make the parent seem wrong. Use the restaurant analogy. And 8. Never hesitate to recommend a second opinion. Now, one thing I didn't say is always try to get things resolved at this initial appointment so you don't have to spend the first 15 or 20 minutes of the next appointment revisiting things. I hope one or two of these things are helpful and it will be beneficial to you in your practice. Thank you so much for listening. I'll see you next time on Tuesday's Tips.